Everyone told me that doing PG was the only path worth taking after MBBS, but I had a PG seat at one of India's top medical colleges like MAMC, and I resigned from it overnight. Here's the comparison no one is making honestly. Hi everyone, I'm Dr. Himani. I did my MBBS from Maulana Azad Medical College. So in this video, I'll be covering my story, why I resigned from my PG seat and why I decided to choose CMS. And after that, I'll be making a detailed, honest comparison between the two paths so you can decide for yourself which path is good for you as per your priorities, your opinions, your personality, and not someone else's. And we'll also be doing a small exercise so as to help you better understand which path is for you. So let's start with the video now. Starting with my story first. So my first NEET PG attempt was in 2024. I scored a decent rank. I was getting branches like ENT, anesthesia, psychiatry, and all the paraclinicals and non-clinicals in Delhi, and a lot more options if I was willing to go outside Delhi. But when the time came to decide, I was not able to decide on any one branch. Nothing felt fit for me. Firstly, I thought maybe I don't know much about the branches and that's why I'm getting confused. So of course I started researching about the branches. I started talking to seniors. I talked to seniors from almost every branch. And after about a month of sleepless nights and constant question in my mind, I finally gave up. I could not decide on any single branch. And that's why I took a drop. Because somehow at that point of time, escaping from this decision felt much easier than deciding on something. Because ultimately that branch would stay with me for the rest of my life. And I did not want to risk that. I did not want to regret forever that I chose the wrong thing just because I was not willing to risk my 1 year. So I joined JRship for a few months because I thought for such a decision, being in a hospital environment would help a lot. And I would be able to see things from a different angle now. So I started observing all the branches. And I also started researching about other options after MBBS, and that's when I came across CMS. And after I learned more and more about it, there was heavy regret. Since I did not give that exam in 2024, I regretted it because everything was looking perfectly aligned with my priorities. But then a question popped up. If this path is so good, why is everyone not taking it? Why is everyone preferring to do PG over this? So I thought that maybe I'm just trying to escape that decision. So I did not pay much attention to this thought. A whole year passed, 2025 came, INI CET, NEET PG, CMS. This time I gave all the exams. So results started coming then. So first result that came was of INI CET May. And my rank was 1414 in that. And I was getting branches like anesthesia and pathology at AIIMS Delhi. And outside Delhi, I would have gotten more branches also. But I wanted to stay in Delhi. And of course, I had better expectations from NEET PG because there are more seats, more options, more branches to choose from. So NEET PG result came next and my rank was 6447 then. At this rank, I was getting all the branches if I was willing to go outside Delhi. And in Delhi also, I was getting most of the branches like medicine, surgery, gynae, all of these. I think radiology and dermatology, if I wanted to go for, I would have to choose a diploma and then do a secondary DNB. But I was willing to do that also if those were the branches I wanted. But again, the same question started haunting me. That was haunting me a year back. Which branch is for me? Because again, nothing felt right. And it felt like I was standing in the same place I was standing a year before. But this time, I had to decide on something. So I reviewed my priorities, what all I can compromise on, what all I can not compromise on, which kind of work I would be interested in doing. And ultimately, after analyzing all this, I decided on one branch. I decided to go for radiation oncology. This is a less known branch and there is not much information available about it. How much ever I could gather, I got to know it has predictable working hours, less emergencies, less hectic emergencies, work-life balance is there, and also the kind of work I thought I would be interested in doing. And I got radiation oncology at MAMC itself. Now MAMC is my MBBS college, so I knew about the work environment and other stuff. So on paper, everything looked perfect. I got the admission done, got my documents verified. I got the medical examination done, and I was gonna report to my department after 1 or 2 days. So basically, everything was done. The only thing left was reporting to my department. Now, something strange happened on the day I completed my medical examination, which was the last formality before my reporting. So, when I was coming back home, I got a notification that the resignation window for counseling has extended to 2 more days. Now, it did not matter to me, resignation was nowhere in my mind, so I did not really pay attention. But when I came back home, I got to know that CMS result has come out, and at that point of time, I just knew that I have been selected in CHS. I did not know my rank, because if you see the PDF, they actually write it as serial number. So I thought 152 was my serial number and not my rank. So at that time, I just knew that I have been selected in CHS. And my first instinct was, PG chhod do kya? And it was so strange that I thought that this is funny. This is just me being funny. But after that, I understood that despite having good ranks in other 2 exams, this exam, I don't even know the rank, but still, this is the only exam whose result has actually made me happy. But at that point of time, मुझे भी लगा था, maybe the grass is greener on the other side. So I thought that maybe I don't know much about this path, and that's why it's looking good to me. So the next day, I talked to some people who are doing this, and I got to know almost everything I could about this. I asked almost all the questions I had in mind. I got answers to all of them, and again, CMS felt right for me. And hence the next day, I went back to MEMC and I resigned from my PG seat. And this is how my whole life path changed overnight. In fact, I created this channel for people exactly like me, to help with the guidance I did not have. And this video is not about my choice. It's about yours. It's about helping you choose your path. So let's move on to the big question. PG versus CMS. Which one is right for you? Now, I'm not gonna answer that question. You are gonna answer that, and I'm just gonna help you. Because I want you to make a decision. Not based on any pressure, any opinion. It should be all yours. So before we proceed, I want you to understand a few things. I want you to have a clear mind. So first of all, keep that log kya kahenge part completely out of your mind. Because you will have to live with your decision, not the society, not someone else, and hence it should be your decision based on your priorities, your opinions. Secondly, you have to understand neither path is perfect. Not PG, not CMS, everything has its pros and cons. And you just have to decide which one you can live with. And thirdly, don't just think of your present self. Try thinking of yourself when you are in your 30s. What would you want from your life at that time? And how would your life look like if you choose PG or if you choose CMS? And then decide which path works best for you. Now I want you to take a pen and paper and write down all the points, and after that I want you to mark every point as ones you can compromise on and ones you cannot. And hopefully that would help you reach a conclusion, at least, if not a decision. So let's start with an honest comparison of the two paths. So first of all, let's talk about the point that was my priority, that is work-life balance. So in CMS, there would be fixed working hours, not just predictable, but fixed working hours. If you get selected in CHS, the timings would be 7:30 to 2, Monday to Saturday. Sundays would be off, all the gazetted holidays would be off. In other cadres also, all the gazetted holidays and Sundays would be off. Even if you get a night duty, for example, in railways, you can have night duties as well. Then you will be compensated for that. The next day would be a post duty off. In some places, you will have 9 to 5 work, and in that case, you will get Saturday and Sunday both off, and other gazetted holidays as well. So basically, your job would be a part of your life, not your entire life. Secondly, coming to PG, all of us know that PG has very unpredictable working hours, and there is a burnout risk. You will have exams, you will have your thesis. Now, what if someone wants predictable working hours but also wants to do PG? Well, then you can go for paraclinicals and non-clinicals. Those are very good options in that case. But exams and thesis would still exist, so some burnout would still be there. Now, second thing is night duties. Again, something I did not want at all. So in PG, of course, you will have night duties, except for some paraclinicals and non-clinicals like pharmacology, PSM. there you will not have any night duties. So again, you can go for that if you want to do PG and not have night duties. In CMS, mostly you will not have night duties if you get selected in CHS, MCD or NDMC. In railways, you have some night duties, but again, as I said, you will be compensated for that. In CHS also, at some places there would be very few night duties, and those will also not be very hectic. And the next thing is exams and the so-called rat race. So after you do PG, of course, you will be tempted to do super specialization. And even if you are not, you will be giving exams. So academic pressure would still be there. Now, if you choose CMS and you're choosing just CMS, you're not willing to do PG after that, in that case, there would be no academic pressure on you. But of course, if you're willing to do PG after that, so you will have to prepare for that. And for those who don't know, after 3 years of service in CMS, you get a study leave of 3 years for doing your post-graduation, and after 5 years of service here, you get sponsored seats. So if you want to join CMS and work for 3 years and then take a study leave, or maybe work for 5 years and then take a sponsored seat, after that you will have one security, you will have job security, that even after you complete this degree, you have a job at hand. So that is another plus point. Now, some people want thrill in their life. I mean, a lot of people I have talked to who want to pursue very hectic PGs like medicine, surgery, they have one thing in common. They want to have thrill in life. So that thrill would be completely absent in CMS. It gets boring after a while. And in PG, you will be constantly thrilled. You will be seeing different variety of cases. You will be doing different kinds of work. So if you want thrill in life, go for PG. Then, considering CMS is a permanent government job, you get an early settlement. While in PG, post-PG, there is no job guarantee. And another thing that PG wins at is specialist identity and clinical depth. So of course, you will be seeing a lot more cases, a lot more complex cases in PG, a lot more variety of cases. Of course, your understanding of the clinical skills would be much better. And of course, you will have a specialist identity. Now, if you are very actively involved in CMS also, you would be able to increase your knowledge. But of course, the graph will not be as steep as someone doing PG. Also, if you want to pursue super specialization or you want to go into teaching, PG is a good option. PG is a better option for your academic career. If you want to become a consultant, if you want to have academic and research opportunities, then you should go for PG. Then the kind of work. So CMS has mostly OPD based clinical work, while in PG you will be handling OPDs, emergencies, wards, all of that. Then comes the social or family perception. So I told you कि लोग क्या कहेंगे वाला part पूरा दिमाग से निकाल के बैठना. If you are still not a person who can do that, and you think you will always have that societal perception in mind, go for PG. Because of course that specialist identity will only be given by PG. Then the next point is toxicity. Do I even need to describe that? I don't think so. Let's move on to the next point. CMS has all the perks of a government job, like you will be a grade A officer, you will have pension, you will have job security, you will have all your leaves, your gazetted holidays, casual leaves, and there would be promotions. Those would be fixed but slow. Like as soon as you join, you become medical officer, MO. After 4 years of that, you will become SMO, and after 9 years into service, you will become CMO, and the next promotion would be after 13 years into service. And you will get cashless CGHS facilities for you and your dependents. Cashless matlab all your health expenses would be cashless in some CGHS facilities in big hospitals like Medanta, Fortis. Basically, health पे कोई ज़्यादा expenditure नहीं होगा. So that is a big thing. So now coming on to deciding which one is for you. Simple. थ्रिल चाहिए PG लो, सुपर स्पेशलाइजेशन चाहिए, एकेडमिक करियर चाहिए, रिसर्च अपॉर्चुनिटीज चाहिए, PG लो. वर्क लाइफ बैलेंस चाहिए, अर्ली सेटलमेंट चाहिए, नाइट ड्यूटीज नहीं करनी है, go for CMS. So let me quickly summarize all the points for you. Work life balance is there in CMS. In PG you will have burnout risk, you will have heavy workload, you will have exams, you will have thesis. Night duties would be in PG, might not be there in CMS. You will be out of the exams and rat race in case of CMS, but you will be stuck there in PG. Thrill is present only in PG, no thrill in CMS. CMS gets boring after a time. Early settlement is in CMS, being a permanent government job. There is no job guarantee in PG. You will get a specialist identity and clinical depth in PG, academic career in PG. Nature of work is only OPD based in CMS, while you will also be handling emergency and ward patients in PG. Social and family perception, of course, would be better in PG. Perks of a government job would be there in CMS, and toxicity would be there in PG. After all this, I hope I helped you at least go closer to your decision, at least get some of your doubts cleared and reach a conclusion. Again, remember, nothing is better. You have to choose which one is better for you. Again, I'm stressing on the word you. So just choose a path that suits you better, and hopefully you will be making the right decision.